So hello guys, good morning. I want to make this video because there has been a lot of misunderstanding about doctor's pathway in Australia. And if you're seeing this video for the first time, my name is Dr. Doris and I'm here to inform you. I'm making this video on request, okay, because I'm going to tell you why I'm making this video. A friend of mine whom we have been working together to come over to Australia as a medical doctor called another doctor in Australia who is also a foreigner to get information from that doctor, and that doctor told her bluntly that she doesn't have a pathway in Australia as a medical doctor who was not trained in Australia. So that actually prompted me to make this video because a lot of doctors are misinformed. He is even the audacity at which he told her to go back to that she can go and study nursing or go back to medical school that is even prompting me to make this video. The truth of the matter is that I don't like people being misinformed, okay? So now, as a doctor that is trained abroad, anywhere else that is not Australia, you can work in Australia. If you have your AMC1 and English exam, it is a game of luck. Some people take up to 3 months, they've gotten jobs. Some people take 1 year to get a job. Some people take 2 years to get a job. But if you're consistent and you do not give up, one day you must get something for yourself. So I don't know why somebody will have the audacity to tell another doctor who is certified with licensed doctor to go back and study nursing or go to the UK. And I'm going to show you guys the response that he gave to her. So this has been going on, and I believe that a lot of people might have been misinformed. Maybe they will tell you that, oh, if you write only AMC1 and English exam, you don't have a means of coming over to Australia, that you cannot work as a medical doctor. That is a blunt lie, a very big lie at that. In fact, the highest lie that I have ever heard in this medical line. So if you come over to Australia as a medical doctor, or let's say that you studied in other countries that is not Australia, as long as you have passed your Australian Medical Council exam, and you have your English exam, you have a chance of getting job. The only thing I can tell you is that with Australian, the AMC2, you have a better chances because some hospital will require you to have AMC1 and AMC2. But even without that, you can still work. Like me, I'm working as a GP and I only have AMC1 and English exam. Okay, I am a practical example of that. So a lot of people will be like, oh, it's not possible. I remember when I wanted to apply for this, when I was looking for a GP job, because I told myself that I don't want to I checked my options because I had babies and I had twins, and I said, look, it's not going to work out for me going to work in the hospital. I think the best option that I have is working as a GP. So when I started looking for GP jobs, I was trying to get information from some people, and if you see what I was told, some people told me that if you have not worked as a GP for the first time, that you can never, APRA will not license you to work as a GP in Australia. My dear, I came in, I didn't even listen to them. I closed my ears to all those things, and I was looking for my GP job, and I got it. And they were not like, even if you pass pesky, APRA will not license you. I am APRA certified, I am APRA registered. This is just a clean example for you to know that it's not all the information you hear that is correct. One problem that international medical graduates have is misinformation. A lot of people will come, I am not good with visuals. Let's say, oh, you look at this, but I will tell you what you need to know. If you're interested in hearing information from the horse's mouth, information that will guide you positively, I will tell you. I am not here to mince words or to say, oh, this one will happen, this one, or to use a flashy screen. Of course, I don't even have the time, because I put out my videos out there so that people can actually see it and learn from it. I don't have time to keep on doing decorations and visuals and graphics. In the end, you end up not getting the message in what I'm trying to say, okay? So the message I'm putting out there today is that if you're a medical doctor that is trained abroad, do not let anybody deceive you. Informations are free of charge. You can get information. You can get enough information if you go online. If you go to APRA website, I'm going to put out the website there. If you go to APRA website, okay, check it out. Check the standard pathway. So the standard pathway requires you to have AMC1 and English exam. Standard pathway never said that you must have AMC2, because if they had to mandate it, they would have made it that, okay, that if you don't have AMC2, you cannot register as a medical doctor. You see the way that UK did their own, okay, if you don't have PLAB2, they won't even give you GMC registration. But Australia is not like that. If you have AMC1 and English and you get a job, that's the only thing. You need to get a job to be able to get Australian license. That is the only difference between Australia and UK. Don't let anybody tell you that, oh, because you didn't study in Australia, you go back and study nursing. Somebody that is a certified medical doctor. That is why I tell my friends and the people that ask me of information that, see, if you want to work as a medical doctor in Australia, keep on working back home. You stand a better chance. A lot of people say, okay, let me come over with student visa. Yes, it also works out like that. But for me, I think that from experience, I would advise, okay, if you've passed your AMC1 and your English exam, stay back home and keep on working and keep on applying so that you don't feel bored and frustrated. Okay, oh, why did I even have to leave? Because that experience, that hands-on that you have is very, very important. It's very, very crucial in dealing with Australian patients. And I mean, anatomy is anatomy worldwide, physiology is physiology worldwide, medicine is medicine worldwide. If a patient had heart failure in your country, it's still gonna be the same symptoms of heart failure in Australia. Okay, so it's just that you just need to keep your eye out to become like a very good clinician. Keep on working and keep on applying. Don't give up. Don't let anybody make you to go back and do nursing. If you want to do nursing, let it be because you also want to be a nurse and a doctor, not because somebody is somewhere misinforming you, telling you, oh, that you need to go back and do nursing, then come in. What a horrible pathway. What a horrible pathway. I have never seen a pathway that horrible. A doctor, you like, the truth of the matter is that if you're a doctor and you want to go do nothing, it's okay, it's good on you. But if you're doing it because somebody says, oh, go and do nothing, that's the only, you don't stand a chance. No, you stand a chance. If you're a medical doctor that you trained anywhere else that is not Australia, you stand a chance. If you have your AMC1 and you have your English exam, you stand a chance. The way that everybody stand a chance is the way that you stand a chance. Just keep on applying. One day you might even be surprised an employer will call you. Prepare well for your interview and you're good to go. Don't let anybody tell you that, oh, you cannot, you're not supposed to, or you don't have a chance, or that this one, or no. Don't let anybody tell you that. That is the most horrible lie that I have ever heard. Okay? So don't let anybody mislead you. That is the whole point of me making this video, because I can see a lot of doctors who tell me, oh, doctor, I'm so discouraged at this point. I thought this was never ever gonna be possible. No, once you have the requirement, standard pathway, look it up in APRA. Competent pathway is for doctors that have worked other places that is not in Australia. Maybe you've worked in UK for 1 year, then you can come in through the competent pathway. You don't need to write Australian Medical Council exam again. I made that video. You can check it out on my other channels where I explained the difference between competent pathway and standard pathway. But look, even if you have 0 GP experience, keep on looking. There must be somebody that is out there that is willing to employ you, willing to help you. Okay? And now Australia have brought out a very wonderful what is called a pre-fellowship program where you can go in and they can pay your supervisors for supervising you depending on your level of supervision. I will talk about that one later on my next video. So if you're a doctor, keep an eye out for my videos. Don't let anybody deceive you. Okay, do what you do. Go out and search your information, sort out your informations, and know that there is a pathway for you with a standard pathway if you have an English exam and PTE. But if you write AMC2, is an added advantage, but doesn't mean that you cannot get a job without it. Because even me, I don't have it. Okay, so thank you so much. If you're still watching me up to this moment, please do me a favor and hit the subscribe button and like this video, and I'll give you more updates. Okay, see ya.